Hello DFR family, it's good to see you again. Let me take this off so you can hear me a little better. I would never thought that we'll be wearing face shields while we're at work. But because of this current COVID-19 situation, it's causing us to do things that we normally don't do. First of all, I want to tell you how I appreciate all the things you're doing, coming to work, having great service, and doing the things to keep yourself safe as well as your family, as well as providing the great service that you do to our citizens. Now, this next video was developed to not only help you understand better social distancing, but also some of the information that is displayed in some of our ERDs to give you a better insight on the daily changes that we have seen in our lives as firefighters, as well as how to disinfect and keep our stations clean. This is going to be a different time for us now. As we've learned from the media, we're expecting hopefully the peak at the end of April, early May. As a city, I'm hoping that that is true for us as responders. But I want you to know that we're working hard to make sure you're safe.
Recommendations and guidelines during the COVID-19 pandemic are updated frequently to provide the most current information to our members. The department must adapt to meet these challenges and will modify exposure protection procedures based on the latest recommendations from the CDC. The most recent changes recommend that everyone should consider wearing a face mask when in public, and critical infrastructure workers, including firefighters and paramedics, may continue to work following a possible exposure, provided they remain asymptomatic and wear a mask as outlined in this directive. As a result of these changes, the following procedures are in effect immediately until further notice. All members must wear a mask at all times while on duty, and social distancing must be practiced at all times, including and especially at the fire station. Why are these new procedures important? Current evidence shows COVID-19 spreads by respiratory droplets. This refers to a spray with relatively large, short-range aerosols produced by sneezing, coughing, or even talking. Droplet spread is classified as direct because transmission is by direct spray over a few feet before the droplets fall to the ground or onto surrounding objects. In contrast, airborne viruses are smaller nuclei that remain suspended in the air for long periods of time and may be blown over great distances. Current data shows COVID-19 is not airborne. That means we can slow its spread by staying out of range of the droplets. Wearing a mask reduces the amount of virus we may be dispersing, as well as the distance it may travel. Social distancing helps us stay out of the range of the droplets' travel. These are simple, smart ways for us to reduce the risk to ourselves and others. Ultimately, all members not working remotely will be issued 2 masks. Please be patient if they're not available immediately. Rest assured they're being acquired as quickly as possible and will be automatically distributed as they arrive. When you receive your mask, it's important to add your employee number or some other form of identification to it, to avoid confusion and possible cross-contamination. On the rare occasion you need to replace one, contact Clothing and Supply as you would for any other PPE. The most important message is that nothing changes with your current EMS PPE and protocols. Emergency response members should continue to wear N95 masks on every response, regardless of the nature of the call. The new fabric masks are an added layer of protection for the rest of the shift. This includes the entire time you're at the station, preparing meals, and interacting with coworkers. To reiterate, These fabric masks are not considered PPE and do not replace your N95 masks required on emergency calls. However, around the fire station and during non-emergency activity, all on-duty members must wear a cloth face mask or surgical mask at all times except while eating or sleeping. Members are allowed to purchase their own cloth mask with prior approval from their battalion chief. BCs will ensure that the masks have a professional appearance and do not display an image that would reflect poorly on the department. They also should meet the following basic requirements published by the CDC. Cloth masks should fit snugly but comfortably against the face with no obvious leaks or gaps. They should be held securely in place while in use, as with ties or ear loops. They should be constructed with multiple layers of fabric, but not be so thick as to restrict breathing. And they should be durable enough to be laundered and dried routinely without shrinkage or damage. The cloth masks should be worn at all times when members are not on emergency calls or needing to wear PPE. One mask should last an entire shift before it needs to be laundered. However, members will use their discretion and wash the masks more frequently if they become soiled or contaminated. At a minimum, they'll be laundered at the end of every shift in hot water and regular detergent. Members are required to wear the cloth masks as well as gloves while cooking and preparing food. Masks are not required while eating or sleeping, as long as members can remain 6 feet apart. At the end of your shift, the masks must be laundered and readied for use again. There may be occasions when cloth masks are not available. If you find yourself without access to a cloth mask, use a surgical mask instead. As you know, surgical masks are disposable. Do not launder or reuse them. If one of your coworkers develops symptoms, follow the station disinfection procedures in Memo 17. After cleaning the station, launder your original mask and don the clean one for the rest of the shift. In addition to the fabric masks, members must constantly practice social distancing, remaining 6 feet apart. This includes your time spent in the fire station itself. As mentioned previously, the simplest way to protect yourself is to reduce the potential for contact with the virus. Backing away and maintaining at least 6 feet of separation will reduce the likelihood of exposure. This is a reasonable accommodation that allows for the continuation of social contact with the simple modification of increased spacing. There's actually some science behind why this makes us feel odd. An anthropologist developed the concept of proxemics, which measures social distances. He believed humans have subconscious, profound psychological reactions to these 4 clearly defined spaces: the intimate, the personal, the social, and the public. When a friend, for example, is encountered in the social space instead of the personal space, this has a real effect on people's feelings and emotions. Understanding the importance of these spaces and how they relate to the current pandemic may ease some of our emotional response. Mealtimes are an important social event at the fire station. During this crisis, we'll have to be creative in order to maintain some level of camaraderie while meeting the spacing guidelines for safety. First, the cooking and preparing of food requires the use of gloves and cloth mask at all times. When it's time to serve, this should be done individually, one at a time, with each member serving their own food while maintaining required distances. Seating will have to be adjusted as well to give each other the right amount of space. In some smaller stations, it may be necessary to reduce the number of people at the table, to eat in shifts, or to find alternative locations for members to eat. Bedtime may present challenges as well. Again, in some older or smaller stations, the bunk-style room does not provide the necessary separation. Officers may be able to simply spread beds apart, or they may have to get creative by alternating beds head to toe or relocating some of them to alternate locations. Whatever the case, all efforts will be made to achieve the distance requirements, or the cloth masks will have to be worn for protection. Members must continue to monitor the IDS posts for updates and new information. This pandemic changes rapidly, and it's important to read the memos, directives, and ERBs to stay current and follow the necessary procedures for your protection. frequent hand washing continues to be one of the fundamental weapons against transmission of this virus. Continue to clean your station aggressively. Per Memo 17, routine daily cleaning of high-touch surfaces should occur at 0800 and 1800. This includes tables, hardback chairs, doorknobs, light switches, remotes, handles, keyboards, desks, toilets, and sinks. Memo 23 explains the employee health screening procedures, which include the continued monitoring and care of our own members. Be sure to wear the required PPE on every emergency call, regardless of the nature. And now, actively enforce the new procedures on cloth masks and social distancing at the fire station. Finally, if you develop symptoms, especially a fever, stay home and notify your chain of command. This is an unusual time in our human experience. The public is looking to us for leadership and reassurance. Continue to do what we do best: provide safety, care, and understanding. Thank you for your continued bravery as we navigate the uncertain waters of this pandemic.
I want you to know that this command staff, as well as the city, we're so proud of how we are, as a department, are continuing to provide great service, continue to make the runs, continue to keep ourselves safe. That we're working daily to try to make sure that we give you all the information we can to keep you safe. And so we're looking at all the different ways to do that, from videos to information on the IDS to our weekly Zoom meetings. And so I ask for your patience, I ask for your endurance, and I ask for you to continue to push forward. We here at 7 May South and all the other work locations are using face masks too. Now, I'll see you later, and it's time to get back to work.